Good afternoon, everybody. My name's Azaf Faruqi. I'm from the Leicester Health Research, and I'm chairing this webinar this afternoon on the ARC East Midlands theme of ethnicity and health inequalities. So thank you so much for joining us, and I hope that you find this webinar interesting and informative. I'm going to do a sort of brief introduction just around some of the key issues, and then I'm going to introduce our three speakers who are going to pick up various themes of work that we're doing at the centre, and then hopefully at the end we'll have time for questions and answers. So I'll just go into my introduction and then I'll talk a little bit about the presentations. So next slide, please. This particular theme, which is a really important ARC theme, and in fact it's not just East Midlands, it's a national theme. It aims to lead a national research programme to deliver and inspire research in health inequalities and increase diversity in participation. And we know this is important because we know that many of the groups in our country who have poorer health often have the lowest participation in health research as well. So whether that's ethnic minorities or deprived communities in general. So the theme also aims to lead the development and roll out of resources and training for researchers, because we know this is a big barrier to developing research in this area. It also aims to involve and engage community groups and PPI representatives, because it's really we aim also to prioritise the research needs as identified by the communities as well. Next slide, please. How are we doing this? Well, the Centre has got a range of programmes of work, and we'll hear some examples of that during this webinar. But it's around collaborating with researchers, universities, community organisations to make sure we get wider participation in research. It's around developing new and alternative methods, because clearly the historical ones, for whatever reasons, haven't always been effective. It's to deliver training programs for research professionals as well as community members as well. And ultimately is to improve representation and also to have better monitoring of participation in research, particularly population-based studies. So that's how we're doing it. So we've got three presentations which will illustrate some of this work. What we aim to do is to run the three presentations and then we'll take Q&A at the end, partly because some of the Q&A may overlap the different presentations. So the way that you can put your questions, you can either put them on the chat or in the Q&A function, and I'll try and pick them up and collate them and try and respond to them at the end. So the three presentations we've got, the first one is around increasing living kidney donation, particularly in the South Asian community. It's a pre-recorded video by Tom Wilkinson, who is one of the research fellows at the centre. He isn't here, which is why it's pre-recorded, but we do have Anna Arson and Gurpreet Grewal-Satini to answer questions at the end. The second presentation is from Dr. Suman Prinjia around South Asian narratives regarding type 2 diabetes. And finally, Dr. Sophie Connell is going to talk about some of the services, support and toolkits that the centre can offer. So we're going to run these three presentations sequentially, and then probably we'll have about 10 minutes for questions at the end. Okay, so we go straight to the first presentation, please, and I hope you enjoy it. Thank you.
Good afternoon, everybody. My name is Thomas Wilkinson. I'm a research fellow with ARC East Midlands. Unfortunately, I can't be with you virtually today, but I'm going to spend the next 15 minutes or so talking about a project that we are doing, looking to increase living kidney donation awareness in ethnic minority groups. So probably a good place to start is by talking about what kidney disease is. So some of you will know that the kidneys are responsible for removing wastes and water from the blood. So essentially they act as a filtering unit that helps maintain the balance of salts and minerals, as well as the important regulation of different hormones. So things like vitamin D regulation, as well as producing hormones that are responsible for the creation of red blood cells and also the regulation of our blood pressure. Now, as we get older, these filtering units in the kidneys become more and more damaged, but they can also be damaged through illness or injury, but also toxicity. And when we have a sustained reduction in the ability of the kidneys to filter blood, this is what we term chronic kidney disease. And this affects about 10% of the UK population, but the prevalence goes up as we get older. Now, many people in the UK with chronic kidney disease can live relatively healthy and full lives with the correct management. However, 5% of people with kidney disease will reach what we call end-stage kidney disease. And this is where the kidneys can no longer support life, and some form of kidney replacement therapy is needed. Now, the available treatments for end-stage kidney disease include dialysis and kidney transplantation. Now, dialysis is essentially where a machine acts as an artificial kidney to filter the blood. Now, the preferred option is kidney transplantation. And kidney transplantation is associated with a significantly lower mortality rate, but also a much greater quality of life compared to dialysis. And in the case of hemodialysis treatment, a patient will have to go into a hospital or unit 3 to 4 times a week for several hours to have the treatment. Now, in the UK, of all the people waiting for a transplant, the majority are waiting for a kidney. And there are 2 types of kidney donation: living kidney donation, which I'm going to talk a bit more about, but also deceased kidney donation. And this is where somebody is donated an organ when they've passed away. Now, a living donor, unsurprisingly, is someone who has agreed to donate their kidney to you whilst they're still alive. And receiving a kidney from a living donor has much more advantages over receiving a kidney from a deceased donor. Generally, kidneys from living donors last much longer, around 10 years longer. They have a much greater chance of success following the operation, and there is generally much less of a wait. So around about 6 months whilst the person goes through the appropriate tests, compared to 3 years, as we'll see if you were to get a kidney from the waiting list. Now, what about kidney donation in ethnic minority groups? So we know that people from ethnic minority groups are at a much greater risk of getting kidney disease. And this is generally because they have a much higher rate of hypertension, so high blood pressure, and a much higher rate of diabetes. And hypertension and diabetes are the 2 leading causes of kidney disease in the UK. And people from minority ethnic groups are what we call overrepresented on the kidney transplant waiting list. They make up about 30% of the 3,000 people on that list. They also have to wait significantly longer than white patients. And the latest data from the NHS Blood and Transplant, between 2020 and 2021, the average waiting time for those from ethnic groups was over or almost a year more than someone who was white. Now, unfortunately, around about 1 in 15 people from ethnic minority groups will die waiting for a kidney transplant. Now, the number of people from ethnic minority groups on the waiting list is significantly larger than the number of transplants that we're able to do in the UK. Again, this is the latest data from the NHS Blood and Transplant report. And you can see here that over the last 5 years, the number of people from ethnic minority groups on the waiting list, so that's that black solid line along the top, is much greater than the number of transplants we're able to do. and that's indicated by the pink bars. And clearly this has been confounded by the COVID pandemic, where the number of transplants was massively reduced. And you can see here that during 2020 and 2021, the number of living donors in particular fell by 58%. And that meant that overall, just over 400 patients received the transplant via this method. In people from an ethnic minority background, there was only 62 living donors during this period. And that was a 61% reduction compared to the year 2019 to 2020. Overall, what this means is that the number of patients waiting for a transplant has risen. And for many patients in need of a transplant, the best chance of a match from an organ will come from a donor from the same ethnic background. And more specifically, kidney donors and recipients are matched by both blood group and tissue type. And what this means is that people from the same ethnic background are much more likely to be a match, and that the donation is much more likely to be a success following the operation. For the reasons I just shown you, what this also means is that 80% of transplants in ethnic groups come from white donors. Now, why is this? Why is there such a disparity? So survey results from the NHS Blood and Transplant suggest that people from ethnic communities perhaps do not know enough about organ donation in general, and this is seen as one of the major barriers to organ donation. There's also cultural and religious perspectives that people might not be aware of, when in fact most religions actually support living donation as they view it as a gift to a loved one. So for example, in Islam, living or altruistic organ donation is permissible provided no harm is done to the donor or it does not disrupt the life of the donor too much. And we know that people who provide a kidney can live very well with just one kidney, and their quality of life is unaffected. So in terms of the project then, so we were awarded a grant from NHS Blood and Transplant to perform or to run an innovative and novel project to try and increase living donation awareness amongst ethnic groups. Now, there's a lot of information online, particularly from NHS Blood and Transplant, around the benefits of living donation in ethnic minority groups. It's available in different languages, there's lots of videos and lots of resources available. And this information is very, very good. However, something clearly isn't getting through or resonating with potentially different communities. And one way that we thought might help increase living kidney donation awareness amongst minority ethnic groups is via art. So this 2-year project is split into 2 phases. Phase 1 is where we're actively looking for submissions of artwork, which I'll talk about in a minute. And then phase 2 will actually be the exhibition itself. So in phase 1, which we're just coming towards the end of, we were looking for art pieces that depicted people's experiences of living with kidney disease or having or giving a transplant. We looked for pieces for people across the UK, and we tried to promote the project through local networks, local news media, social media, and also the NHS Blood and Transplant scheme itself. We were looking for people both living with kidney disease, those who'd received a transplant, especially from a living donor, and donors themselves. And Henna and Gurpreet, community engagement officers from the Centre of Ethnic Health Research, have been absolutely fantastic in terms of actively engaging with local community groups and individuals and spreading the word about the project. In phase 2 of the project, once we have all the pieces, we're hoping to host them in a free virtual exhibition. This works a bit like augmented reality, where you'll be able to walk around a virtual gallery using your keyboard or mouse. You'll be able to look at each individual piece. The artwork itself will be interspersed with facts and information around living kidney donation. And what we're able to do is then make this information available in different languages with different translations in terms of voiceovers as well. If appropriate, we're also hoping to do a public exhibition, and this will take place in collaboration with the Attenborough Arts Centre. Hopefully this will take place towards the end of this year. And alongside the exhibitions, we're planning on running focus groups with people from ethnic minority groups to really explore in detail the barriers and the facilitators to both living kidney donation, but also organ donation in general. And what we're hoping to do is then use these groups to evaluate the project as a whole and whether art as a method to raise awareness amongst these groups is sufficient. In terms of the next stages of the project then, so at the time of recording this presentation, we've just closed a soft deadline for artwork submission, but we know that we're still expecting a few more pieces to come in. We've actually received lots of stories, written stories and poems from people, and they've kind of said that they don't want to necessarily produce a piece of art. So what we're able to do then through the collaboration with the Attenborough Arts Centre is we're in the process of finding an artist who will then transform those stories and those poems into some physical art pieces. Once we've got all the pieces, we'll then start to build the virtual exhibition that we hope will be ready in the summer. And then we also plan to start our focus group work following ethical approval. So watch this space, and hopefully over the next couple of months we'll have some pieces to share with you all. So I'd just like to thanks very much for listening and attending this webinar. Another thank you to Henna and Gurpreet, who have really been driving the project forward, but also Marie and her team at Attenborough Arts Centre, and Ollie and his team at Orange Juice Communications, who have really been fundamental in publicising the project and has allowed us to go on the radio and on TV to speak about it. For more information about the project, if you go to Ethnic Health Research website, go to the project tab, and you should be able to find our Living Kidney Donation project there. So thanks once again for listening. Unfortunately, I won't be here I'm not there to answer any questions you might have, but feel free to drop me an email if you have any comments or any questions about the project. Thank you.
Okay, thank you very much, Tom, for that very clear presentation, which was pre-recorded. We do have Henna and Gurpreet from the team to add some further perspectives or answer questions at the end. So we'll now move on to the second presentation, which is by Suman, which is around South Asian narratives and perspectives on research in diabetes. So over to you, Suman.
Great. Can you see my screen okay?
Yes, very clear. Thank you.
Great. So I'm going to give you just a snapshot of the qualitative work that we've been doing over the last few years with South Asian communities in Leicester. I'll be focusing on experiences of type 2 diabetes and on developing culturally appropriate health information. So I'm going to talk about our work with first and second generation people from Bangladeshi, Indian and Pakistani groups, as these are the communities that we've been working with so far. So in 2016, we started working on a study to explore South Asian views on a text messaging system that aimed to support people to take their diabetes medication as it had been prescribed, has it been recommended by their doctor. And this was part of a larger study called the Summit D study, an NIHR funded study led by Professor Andrew Farmer at the University of Oxford. And the larger study included a clinical trial, and it focused on sending text messages to the overall UK population. In our work package on South Asian perspectives, we wanted to explore whether short text messages, reminders such as the examples on the screen, would be relevant to South Asian people. We already knew that type 2 diabetes disproportionately affects South Asian groups. We also knew that when it comes to managing diabetes, digital devices, including mobile phones, can lead to improved health outcomes, and this includes positive impacts on blood sugar levels. And from previous research, we also know that health interventions that are culturally adapted to the needs of specific groups are more likely to be relevant and acceptable. But we still don't know very much about how best to adapt these interventions to meet the needs of South Asian people with diabetes. So we conducted a formative study consisting of 8 focus groups with Bangladeshi, Indian and Pakistani communities. We had a diverse group of 67 people taking part, aged between 18 and 84. And we ran the focus groups in local community centres in English, Punjabi, Urdu, Bengali and Sylheti and Gujarati. Our participants who used mobile phones felt that short messages like the ones I showed earlier to support medication use or medication adherence could be acceptable, they would be acceptable and relevant. But participants didn't want information only about medication. They also wanted text messages that would support other aspects of managing their condition. So they wanted information about food, diet, exercise or physical activity, and stress management. So information about the emotional and mental health aspects of living with type 2 diabetes, as well as medication use. And when it came to food and diet, participants talked a lot about the information they wanted and the text messages that they would find helpful, including messages specifically about South Asian foods, portion sizes, commonly used herbs and spices, natural and herbal approaches used here and in South Asia, and information about religious fasting. They felt that short messages in English were acceptable given the demands on funding, given that the messages are really short, less than 160 characters or around 160 characters, and that family members or carers could help translate the messages for them. Older people in particular who didn't use phones very much or didn't use phones at all felt that face-to-face meetings would be helpful. So they wanted the information, very keen on having the information, but in perhaps a community setting such as a mosque or a community centre or a temple where they could meet together, share information about diabetes and learn from one another, and preferably with a health professional present to answer questions. And this work was done before the pandemic. And we published a couple of papers in peer-reviewed journals on this work. We also held a workshop to share our findings with our participants and with community organisations. And in the workshop, we asked participants what they would like researchers to focus on in terms of the research they conduct. And I'll come back to that a bit later. In 2020, during the pandemic, we started new engagement work on developing culturally appropriate health information for South Asian communities. COVID-19 highlighted the urgent need for culturally relevant information as the virus disproportionately affected ethnic minority populations, including South Asian groups. And although written, audio and video information was being produced at pace during the pandemic, there was and still is very little guidance on the optimal ways of developing culturally appropriate or culturally sensitive health messaging. So in February 21, we conducted 5 online community engagement workshops with Bangladeshi, Indian and Pakistani groups to learn firstly more about their views and experiences of COVID-19 health messaging, and secondly about developing health information resources that focused on long-term conditions that disproportionately affect South Asian communities. And 50 patient and public contributors took part in these workshops. People again from Indian, Bangladeshi and Pakistani communities. The main themes about COVID-19 specifically, information about COVID-19, you can read more about it in our report, but the main themes focused on the importance of having information in multiple formats from multiple sources. So participants accessed information about COVID from a wide range of sources depending on levels of literacy and fluency in English. This included national TV, South Asian TV channels and radio channels, social media, community organisations and community leaders, and also from other family members. You can read more in our report. Participants also talked about trust and distrust of information and having too much information or information overload. And also they talked about the varied impacts of the pandemic on mental health. Many participants stressed that there was a lack of information about COVID and mental health for South Asian communities, including educational videos about isolation, loneliness, anxiety and depression and bereavement. And I was also hearing a lot about these issues in the community through my work as a psychotherapist. The second part of our workshops involved discussing participants' views on developing information resources for Asian communities. And to prompt discussion, we showed participants a 6-minute video on South Asian experiences of type 2 diabetes and emotional health. Our participants said that educational videos in different community languages with subtitles were their preferred format for having health information. They also discussed the need for culturally appropriate health information, which was seen as vital, not just because of language barriers, but also because information could fill in gaps in the knowledge of patients who have poor access to healthcare. Information can promote better self-care and raise awareness. It can improve communication between patients and health professionals. And it can also help break taboos or dispel myths about health conditions, especially sensitive issues such as mental health. So there was a clear need identified by patient and public contributors for culturally sensitive information. Participants also talked about the perceived impacts of educational videos in community languages. And these included improving confidence around self-management, providing a sense of control which could lead to better self-care, improving understanding, instilling hope and motivation when hearing about the experiences of other people, and providing support to patients and their families. This was seen as important for many reasons, because people felt that hearing about the experiences of other people in the community who were living well with their condition could be motivating and could promote better self-management. They said that hearing from people who had recovered from a condition, perhaps depression, could also instill hope. And participants also discussed the length of videos, the content of videos, and they talked about the COVID videos, which they found helpful. Often they were about 1 or 2 minutes long, but when it came to long-term conditions, our participants said that longer videos, perhaps up to 30 minutes, could be more helpful. So you can read more about that in our report. Dissemination was also an important topic where participants felt that information needs to be disseminated as widely as possible through community settings, GP surgeries, South Asian TV and radio, and community pharmacy. Their views highlight the importance of co-producing resources with patients and other stakeholders working together so that we can ensure that resources are relevant and acceptable to patients and their families, and that they're disseminated widely. And this includes sharing resources and information through social media, patient and professional websites. Participants also mentioned having videos in GP surgery waiting rooms and community pharmacies. And this work was funded by the University of Oxford. We also wrote a BMJ opinion piece about the report, which you can find online. When we ran a workshop and asked participants about their views on what they felt researchers should conduct research on, they mentioned a number of topics. It's vital to listen to what people from South Asian communities want us to conduct research on. and to work with community organisations to co-produce resources that they feel would be helpful. So our participants mentioned several topics that they felt they would like to have more information about or more research on, and that included type 2 diabetes and the mental health impacts of diabetes. They also mentioned the physical and mental health impacts of other long-term conditions that disproportionately affect South Asians. And this included information and research on people's lived experiences. They also said they wanted more information about the impact of diabetes in different Asian communities. So, you know, the differences and similarities between experiences in Indian, Bangladeshi and Pakistani groups, and more research and information on diabetes and the impacts on family members and carers where there's a lack of research. More in-depth research is also needed with specific groups. So the umbrella term ethnic minority or South Asian can sometimes disguise differences between groups and within groups. All of the qualitative work we've done so far has involved researchers, community engagement officers, and community organisations working together. So people from different communities with different skills, knowledge and strengths working together. And that includes Nasima Mia from the Centre for Ethnic Health Research, who did a lot of the recruiting, and we both co-facilitated the focus groups and workshops. Gurpreet, who you met earlier and who's going to answer some questions later, who helped with some of the workshops and also works at the Centre for Ethnic Health Research. Sonal Bavsar runs a self-help group and helped conduct some of the work with Gujarati Hindu communities. And Ibrahim Ali helped with some of the work with Bangladeshi men and focus groups and workshop with Bangladeshi men. And you can find out more about how we conducted our work in our paper on conducting focus groups with South Asian communities. We also talk more about conducting focus groups in different languages, translation and community awareness. There's more on our Centre of Ethnic Health Research website and about the courses that we run on community awareness. So I'll stop here. Thank you very much, and back to you, Azar.
Thank you very much, Suman. There is some comments on the chat, which I'll try and pick up in the discussion afterwards. So thanks for that. So we'll move now to Sophie, who's going to talk about some of the services and resources that the Centre for Ethnic Health Research has developed. So over to you, Sophie.
Thank you very much, and hello to everybody. I'm joining here as the Operations Manager for the Centre for Ethnic Health Research. And we've heard some fantastic examples from Suman and Tom and the team about how we are tackling, trying to reduce ethnic health inequalities, which is essentially our main aim as a centre. And Azar touched on in his first slides of how we're doing that, and I don't want to repeat too much, but essentially it is our great team that we have with their own expertise and their own skills, collaborating with other groups, so other researchers with other expertise, community organisations, community members. We're collaborating with them to ensure to increase participation of underrepresented groups are included in research, and also that healthcare provision is more inclusive and diverse for everybody, so that we can tackle health outcomes as well. So I basically just want to highlight to you how the Centre for Ethnic Health Research could maybe support any of you guys that are watching here today with any of your research. If you wanted any support, this could be, there could be some services here that we could provide for you. So it may be through patient and public involvement and engagement. And the principle underpinning public involvement is to really promote research which is conducted with or by the members of the communities that you're trying to engage with, rather than it being sort of to them or about them. It really is about involving them in that process.
Sophie, sorry to interrupt. Can you put it on slideshow, because I don't think the slides are moving.
Oh, okay.
Thank you. Sorry about that.
It is on slideshow on mine. I wonder if Laura might be able to share the screen if it's not working.
Yeah, it's sorted now, Sophie. That's great.
Perfect. Thanks so much. So yeah, whether that be through our public patient and public involvement, but we utilise our community engagement officers and their breadth of experience and connections into communities. We could work with you to ensure that they bring communities to you, to talk to you, to allow you to shape your research around the needs of these communities. And our engagement officers are very much valued members of several different communities, and they have some trusted links whereby they can help you form your own relationships and work with them. We've done a variety of PPIE activities, whether this is just awareness activities within the community, so whether that be within workplaces, within universities, or even within community settings such as places of worship. But we also work alongside our sporting community as well, within Leicester particularly, to be able to host sort of taster events which don't have a focus on health in research, but it provides an opportunity to open up those conversations in a very fun and sort of friendly environment. We also know that participant recruitment can be quite difficult. It may be that different approaches are needed, and this could very much be quite time consuming to researchers. But the limited access to ethnic groups can greatly impact on the ability to successfully recruit these participants into research, and that leads to less robust results. So it's really important that we can help you with looking at recruitment strategies that are suited for ethnic minority groups. And our community engagement officers can help with that. They can help advise on strategies that may be more culturally adapted and they're more suited to the needs of the people that you're trying to reach. It may be that we could also link you in to relevant community groups who could help you with your recruitment as well. So next slide, please, Laura. Thank you. So we also at the centre have expertise in qualitative and quantitative research methods. So we might be able to help you and offer some input at all stages of your research process, maybe assist you in the priority setting, pre-application PPI work, whether that be sort of bringing together focus groups or interviews with different communities. We could also help with thinking about the implementation of a piece of research that you're trying to do and dissemination of those results. Essentially, it's really important that we try and ensure that efforts are made to reduce any of the barriers to ensure that ethnic minority groups can be involved in research. And one of those may be a language barrier. So we do offer some translation services, and then looking at culturally adapting resources to ensure that they are more suited to the group that you're trying to target. And a brief example of this piece of work is that we've actually worked in the past in the development of a type 2 diabetes risk screening tool, and we've successfully translated that English version into Bengali, Gujarati, Punjabi and Urdu versions. And they all have been translated and culturally adapted to ensure they meet the needs of those communities that need those translated versions. We've also had some success in different alternative research engagement methods. Tom showed a nice example of how we're using arts-based methods to engage with different communities to raise awareness of certain health conditions. And finally, we are a centre that we are a university organisation, but we sit on NHS grounds. So we're in quite a unique position really to access wider and further resources, which may be helpful to research groups. For example, we're really closely linked to the Leicester Real World Evidence Unit. And this academic team has access to large data sets, so including anonymised medical data, and they have expertise in meta-analyses and systematic reviews, which may be a great starting point for many academics looking to identify certain research questions or the priorities that they need to focus on. So as a centre, we could definitely link you in with wider resources. And next slide, please, Laura. So public sector organisations do provide mandatory training for equality, diversity and inclusion. However, it's very much a light touch, or tends to be light touch, maybe non-interactive and potentially non-research focused. And this evidence from academic institutes shows that this mandatory training, if it's looking at mandatory training for reducing bias, it doesn't always lead to behaviour change or attitude changes or practices within that setting. Where it does have positive outcomes is when this training is actually over a longer period of time and it's coupled with different diversity initiatives that target both your awareness but also your skills-based development. And in light of this, the centre's developed 2 different courses, which we currently deliver in person, though mostly over virtual means at the moment, and it's aimed at specifically at researchers. So the first is effective community engagement, and this course really does aim to increase people's confidence and competence to be able to engage with different community groups. It focuses on some practical examples of how to engage with these different communities. And it's delivered over 2 sessions a week apart, and it's about 6 hours in total. But this really allows for reflection from the first to the second group, and it really consolidates the learning that you experience within that training session. The second is our cultural competence training. So cultural competence is absolutely vital to address health disparities that people of culturally diverse backgrounds often experience. And being able to understand and becoming more self-aware of different cultures can really improve the diversity and inclusivity of research. This course is held over 3 half days, so that's about 12 hours in total. It's very much an interactive course with group-based activities, and we really encourage our participants to challenge their own beliefs and their own behaviours, looking at things like unconscious and conscious bias and stereotypes. So cultural bias is highly prevalent within the healthcare system and clinical trials, and it can be a source of miscommunication, maybe mistrust, and maybe decreased patient satisfaction. In the research arena, this can actually result in maybe limited diversity of research participants. And the reduced engagement of these minority populations will result in a reduction of the relevancy and the meaning of the research that you're conducting, because it won't be relevant to those wider populations if they're not included. And that could actually further impact on the pre-existing health inequalities that these community groups are already experiencing. So cultural competence really is a course that we recommend, and it will give you an idea of how to engage with different communities and really challenge your own beliefs and make you more self-aware. And the next slide, please. We've also developed a number of training packages and resources as well to kind of supplement our 2 training courses. And they'll help researchers become more culturally aware, be able to conduct effective community engagement, and increase the diversity of their research participants. One of our courses is online. It's a free online training module called Increasing the Participation of Ethnic Minority Groups in Health and Social Care Research. And this is an online toolkit which provides researchers with a framework to improve the participation in research, making it a lot more diverse and a lot more inclusive. It will help you develop more relevant research questions, maybe consider engagement of different ethnicity groups in a more structured way, and provide some tips on better participation and dissemination of those research findings. And it allows you to work through it at your own pace, and it's freely available online. And you can access this through our own centre website, which will take you to the NIHR Learn platform. And next slide, please. So the NIHR Arc East Midlands and the centre are really making great strides to making research culture and practice more inclusive. And we're taking steps to advance the equality of opportunities, eliminate discrimination, and engage people who have protected characteristics in the development, the implementation, and the dissemination of health research. And an equality impact assessment is an approach which we designed to improve the equality analysis, practice, and outcomes of research. It helps researchers determine and understand how what we are going to do may impact different people differently. And the most important outcome of this process is ensuring that groups and individuals who face disadvantage and underrepresentation are visible in the priority research settings. So we've developed a toolkit to help researchers go through this process in a very clear way. And alongside this toolkit, we've also developed a short video. And this presentation within this video will just help guide you through that process, through that toolkit, to help you develop your own research ideas. And next slide, please. So we've also been involved in a wide range of projects. So we don't just lead our own research, we obviously collaborate with other researchers as well, tackling health inequalities, but also to try and help improve health outcomes as well. And our website has a page where all of these research outputs and resources are stored. So there's resources on there which will help researchers strive to making their research more diverse, more inclusive. So that would be things like our quality impact assessment and our online training toolkit. But there's also a series of videos on there for researchers to look at raising awareness of the inclusion of underserved communities in their own research. And also videos which you will hear directly from the public perspective that discuss their beliefs, the barriers and enablers to them taking part in research. So there's certainly a few things for you to have a look at and maybe reflect on and review your own research pathway going forward. There are also some specific COVID-19 related resources that we've developed through the research that we've taken part with over the COVID-19 pandemic. And this may be reports that identify ways of how health information has been shared and provide some practical tips for sharing information with different community groups. And finally, there's some resources on there that actually support individuals with their own health. So I mentioned the Leicester Diabetes Risk Score tool previously, but we also have things that are based on evidence, such as health booklets, which look at providing healthy living sort of tips for South Asian communities, and also the African and African Caribbean communities. And all of the food examples are very much culturally adapted to suit the needs of that community. There's also bits around how to manage type 2 diabetes during Ramadan for the South Asian community. There's things on there that will provide awareness of sickle cell disease and also around prostate cancer. So they're very much for your individual communities to access and utilize if they wanted to be raised awareness of certain disease groups. And on to the last slide. This is really just where I tell you how best to get in touch with us if you feel like we could be working together in the future. So if you wanted to talk about any of your research coming up, the best way to do that is to reach out through our website. So if you go onto our website, the website address is on this slide, and go onto our services tab, you will see about halfway down there is a contact us, 3 tabs there. It will take you to 3 different forms based on what kind of support you're after. If you're able to complete those forms with as much information as possible, the team would be able to discuss these and be able to get back to you to discuss how a program of support could be implemented. If the training seems like options you guys are interested in, there's our mailbox if you wanted to contact the mailbox directly to discuss which options you'd like to take part in. And you can of course see what we're up to through our Twitter and Facebook pages as well. But that's it from me.
Thank you, Sophie, for that presentation. Clearly a lot of information there that's come across. Okay, we've got about 10 minutes now for a bit of discussion and Q&A. So thank you for everybody who's posted comments on the chat. So I'm just going to go through some of these and I'll bring the team in for comments as we go through this. First of all, there was a comment rather than a question around really around the theme and how we phrase things. So for example, around kidney donation, it's probably not right to say that communities aren't informed. Really, the issue is how we inform them rather than having any connotation of blame about people not having the information they need. So I think that's a valid point, and I think we all would probably support that. So the first question, following on from that, for maybe Hannah and Gurpreet, is why did you select this method of sort of using art to inform? Does it have an evidence base? Intuitively, it seems like a sensible thing to do, but do you want to talk about why that was selected and if there is any evidence base to it as to why it might work? Thank you.
Hi, yeah, I'm Hannah. Just to sort of come on to that question, I mean, I know that the centre has done various different projects and has employed the use of art in different ways. And through different projects before, we found that art has been quite a useful medium. So that's one of the reasons why we thought using art would be quite beneficial to be able to reach people in different communities and the wider public, really. And I think one of the reasons of doing this project was to be able to capture real life lived experiences. And we feel that that is really quite powerful to be able to raise awareness of living kidney donation. I mean, myself and Gurpreet have gone out in the community and we've spoken to lots of different people. And I think what we found is that a lot of people might know quite a bit about having a kidney that's donated after somebody's deceased or passed away. But the idea of living kidney donation being an actual thing, I think a lot of people have found it quite interesting. And being able to sort of capture that in the art form, I think is a really creative way of doing that. So I think that's one of the reasons why we decided to go down that route. Okay.
Thank you very much. Okay, the next question is probably directed at Suman, but other people can come in as well. It is really how you went about promoting your study and recruiting participation, and how you perhaps did that in an inclusive way as possible. I don't know, Suman, if you want to touch on that, because clearly you had a large number of participants in the studies that you described.
Yeah, and we talk more about it in our paper, but just briefly, working together, researchers, community engagement officers and the community organisations was really key to the way we worked. And the community engagement officers that we worked with, Nasima, Gurpreet, many of them had relationships with the community organisations that they'd built over a long time. So they'd been working with some of the organisations for over 10 years, built long-term relationships of trust and acknowledging their contributions. And that really helped when it came to recruiting. So with the focus groups, Nasima did a lot of the recruitment, and Gurpreet and Sonal and Ibrahim, and they'd already been working with the communities for such a long time. So that was key to the recruitment, working alongside the community engagement officers and the community organisations. It's also important to keep those relationships going. So, when we did the workshop, we invited the community organisations. When we did the COVID-19 work, we also got in touch with the organisations again. So it's building those long-term relationships and working together that's been really helpful. A big thanks to the community engagement officers at the centre who really do a fantastic job.
Thank you, Suman. Another question that came up, and again, it's for all the presenters, is, well, it didn't come up actually, but it's been raised in the chat, is this issue of trust in researchers? Because we do hear sometimes that some ethnic minority groups don't trust health research. That wasn't raised in any of the presentations. I don't know if you want to make any comment around it, whether it's a generic issue or whether maybe it's an issue more for certain age groups or for certain ethnic groups. I don't know if anybody.
building the long-term relationships is really key with trust. So, you know, when people are familiar with you and you're familiar with them, and you do face-to-face visits with local organizations, support groups, that helps a lot. And with the community engagement officers as well, they're often in the community, visiting organizations, letting people know about the work that we've been doing. Keeping organizations and people informed of what you're doing, you know, throughout the study also helps. So, you know, building trust does really depend on those long-term relationships and visiting organizations, inviting them to the centre, for example, when we're talking about the findings. I don't know if Henna or Gurpreet want to say anything about trust as well.
Yeah, I think I totally agree with you. It's working with the community as well as researchers. So whatever we do, we start and we do some work, and then always going back and feeding back what we've learned so that they are aware, and then they can also help shape things in future as well. And when there is something happening in the community, being there, supporting them as well. So like you said, it is a long-term relationship which needs to be you know, kept alive throughout. So once you've done your project, you don't just leave it. So we do tend to keep in touch with them on a regular basis.
Well, I think all the comments you made on trust are really important. The importance of building long-term relationships, of making sure that you keep people informed. They just don't participate in research, but they should learn about the outcomes of it as well. But I think this trust issue is variable. In my experience, often you find older South Asians, for example, are extremely trusting of healthcare professionals. Younger age groups may not be, and sometimes some of the experiences of particularly the Afro-Caribbean and Black communities, sometimes their trust is sometimes low in those groups as well. But I think the way around it is to develop those long-term relationships. It's around using community engagement methods, and researchers who are very much part of those communities as well. I think that helps rather than having outsiders. But yeah, I think trust is something we always need to be aware of. The other issue, someone I wanted to raise, is maybe, do you think there's a tendency of the same people sort of getting involved with research over and over again? Are we wide enough in our participation, or do we tend to have a bit of a sort of a group that likes to participate and we use the same groups all the time? Any comments on that?
We haven't found that we've been having, you know, recruiting the same people again and again. So with the focus groups that we did with people who were living with type 2 diabetes, they didn't also attend the workshops on COVID-19, so they were very different and different age groups. So we haven't found that so far. But just, you know, going slightly back to the issue of trust, there's a video that the centre made, funded by the NIHR, where patients and public talk about issues of distrust, which are quite understandable. I would really recommend that video. And Gurpreet, you know, I don't know if you've found, or Henna, whether we're recruiting the same people again. I haven't found that, but you know, you may. I don't know whether you've come across that.
Yeah, no, I can come in there. No, I don't think we are kind of recruiting the same people all the time. I think, like you said, I'd probably just echo what you said, actually, that a lot of the research areas are in different areas. So because of that, we end up then recruiting people in different areas and different backgrounds, because people might have different interests, or a certain area might affect one person more than the other. So we've just found that that's kind of what's happened, where we're not necessarily getting the same people again and again, which is obviously really good for us, because then we can get a lot of the variation and different viewpoints and kind of different views in different communities.
Yeah. We've also been quite flexible.
Good question. Sorry, we're a bit short of time. There was a specific question around people with learning disabilities, autism, or may have other access issues. I don't know if in your research you make any particular efforts to recruit some of the even harder to reach groups.
So I know I'm going to put Gurpreet on the spot there, but I know Gurpreet is working hard with different community groups. And I think it kind of mirrors what Henna was saying. I think at the moment, we're not necessarily tapping into the same people for our focus groups, but our community engagement officers are always working to make new relationships. And they're always putting in that time and that effort to build those relationships. And I do know that one of them that Gurpreet is working on is making sure that we are able to work with people with learning difficulties. And I know you've done a piece of research, haven't you, Gurpreet, looking into that?
Okay, excellent. We're a minute over time, so I think that's a good time to stop and end this webinar. Thank you very much to the presenters, brilliant presentations, and thank you to the attendees as well. We've had over 60 people log on, so that's really good. And I hope the webinar was informative and instructive. Thank you very much.